from whom we have learned. So this instructional course in microsurgery, we have planned to show,
Today, the lecture is going to be, it was aimed at postgraduates to give an instructional course on microsurgery. Hospital or getting to a friend to say that, yes, I can do a microsurgery in any free flap patients, refer to us, we will do it. First thing is you need to have a good microscope.
And magnification, as what Somesh told. So I asked, what is the preferred magnification? If you see, majority of them, around 70% says. Huh?
The points what all you have just mentioned on the last slide. I think to start off, I think we have to go with the set standards. No need to go and find new things. Always 2 veins. Intraoperative heparin I use whenever, especially in a crushed injury, or you have done an anastomosis on table, and then you face a.
This one, the size of the coupler should be chosen on the smaller size. Suppose one is 2 mm, the other side is 2.5. Then it is chosen to be 2 mm. You have to choose the smaller one. So now we are choosing based on the size.
You who have reached here. This idea of getting the aesthetic surgery into instructional course was a new one. We thought because this is the field where a lot of people are interested in. Can I have the slides? Introduction slides? Oh, I can't see that. Okay. Thank you. Sorry for the trouble. Yeah. So we thought, why should we have like I was saying, because I think this is the need of the hour. So
good morning, everyone. It gives me great pleasure to see you all, and thank you very much for this opportunity. Usually in our TANPAPS, we don't concentrate much on aesthetic, non-surgical procedures. Okay, moving on to the second topic, microneedling. An important tool in a plastic surgeon's arsenal. Why I said this? Because till I finished my post-graduation, I was not much aware about what microneedling was or how it could help. But
thank you for the opportunity, respected professors, seniors, and my dear colleagues. I am going to talk about common topic in aesthetic surgery, but this mostly done by video. Okay. Videos, it is there. Thread lifts for the face. There are other lifts for the neck, and also submental areas are all there, and there are threads available for breast lift and also body lift also. There are multiple threads now available. These are all some before and after pictures of jawline reshaping.
But always the non-surgical facial rejuvenation with the Botox and fillers always has a role. And as a surgeon, we are very confident in putting fillers than the physicians. Repeated action of facial muscles over time leads to development of rhytids because of frontalis, procerus, temporalis, and corrugator and orbicularis oculi. So effects of aging on the upper face, usually the facial muscles are concealed by the subcutaneous fullness in the youth.
And also there are so many myths surrounding this wonderful light. And of course it is a very powerful machine, very powerful laser, but when used wisely, there are so many benefits. I'll be discussing briefly on
enhance your knowledge and enlighten their career and improve our skill in wound management. So basically, in dressing, we want to make it more interesting, and for your benefit, for your little shopping also, we want to give you some funds. So for that, we need your cooperation. At the end of this course, we will conduct a quiz session. No, wrong. Yeah, tell me. It's just a single word. It's just a single word. Yeah.
base of first metatarsal.
No, no. Guess the pressure point.
I am Sudalai from Dr. Reddy's, and we have Dr. Reddy's channel for the two companies, Integra Life Science as well as LNR. First of all, I am going to present for IDRT. This is the Integra Dermal Regeneration Template. As you all know, this is the first acellular dermal matrix pressure therapy. This is basically LNR company. You know very well. This is a you know about NPWT. This is a very handy machines, less than 1 kg weight. Patient can easily carry their.
One of the most important ways to prevent pressure ulcer is no. Some more guess? Position. Yeah, okay. Yeah. All, the doctor got the gift already. உங்களுக்கு நீங்க next question answer பண்ணுங்க. Okay, what is this? Don't tell Pawan Kalyan, okay? Very high. Cracks, not really. Sorry? Okay, fine. We'll give for the dry skin. Who said dry skin? Yeah. Give to Dr. Kaushik. You'll get the first prize of 5,000 cash. Sir, give it. Dr. Anup, friends of Dr. Anup. Thank you.
Good afternoon, teachers, colleagues, and consultants and junior plastic surgeons and delegates. It's really a pleasure to enjoy our GK's hospitality arrangement, and
I greatly owe to Dr. G. Karthikeyan, Professor Karthikeyan, for asking me to be an opening batsman. I told him that the 2 o'clock is a very bad time. Half the people will be in the lunch room. You all know, knowing others is intelligence, but knowing yourself is wisdom. The next comes to the creativity unit. So I got a lot of attachment to the hand surgery and plastic surgery. But today, great demand has come with subspecialties like craniofacial surgery, microsurgery, burns, and cosmetic surgery. But if you see any specialty you take up,
so when you look into the ear, it's a prominent structure in the face and more prone for trauma. Deficiency is in this structure or any altered appearance draws attention from everybody, and hence there is a need for reconstruction. When you see that, you can see a lot of degree of deformities varying from a mild one to a complete absence. In case both the ears are deformed, we need to look for another person of the same age, or in case we want to have the same familial characters, probably look for a person in the family. Placement of the ear can be made with the measurements from the opposite ear from the midline. I always make a transparency and mark the...
Neurosurgeons will do decompressive craniectomy, and we get a lot of cases in that, so I will be talking on that. What is cranioplasty? Cranioplasty is basically a surgical procedure to restore the calvarial form. We are just restoring the form of the skull and with hard tissue replacement. Then why at all we have these cranial defects? So what is this? We can have congenital or acquired. In acquired defects we can have mostly what I will be talking about it following decompressive craniectomy. this 3D prefabricated implant. Sometimes we combine implant and some residual defect remains, we use a mesh to cover it. Then if sometimes dural injury happens or you have to drain the dura, then we use a pericranial flap, and a pericranial flap has been used to cover a dural defect.
From a societal point of view, burns are an important issue because the victims are either breadwinners of the family or homemakers or younger children. Apart from the acute illness.
And from the newborn, we have seen a lot of burn incidents. And we always take care of them from the day one and see that they recover fully. And here a lot of things are there, and I will go one by one. Burns are the most devastating form of trauma. Though survival has improved over the years in major burns all over the world, the scenario in India is different. Delay in arrival of the burn facility from remote places, lack of early coverage of the
at home or in the industry, and of course they cause tissue injury. The injury depends upon various types, the type, quantity, concentration, the physical form, if it is solid, liquid or gaseous form of the agent, and the duration and the site of contact. The homicidal action of throwing corrosive agent on another person with intention to disfigure, kill or maim is called vitriolage. These are usually preventable burns, especially in the pediatric age group. Safe storage is imperative. The child on the right, it drank acid from the bottle because stored in PET bottle, so he thought it was a beverage. And this lady on the other side, she ate up Dranex powder, which is a drainage cleaner. Unfortunately, it contains of both high sulfuric acid and sodium hydroxide.
Sepsis, but there are other things like the cannula. There are sepsis that originates from the GI tract, lung, and the nosocomial. So when a burn happens, the wound becomes sterile. Then it becomes colonized by the organisms. So the source can be from the healthcare personnel, visitors, patients, or from the environment, from the equipment. When you think of the pathophysiology, it is the reduction in the immunity, both innate and the immune cells that are not able to perform their function, which...
Now we will start the aesthetic aspect of the session. First I invite Dr. Kamakshi. She will talk on breast reduction. Dr. Kamakshi.
For a wonderful event organized. I'm going to share some of my experiences with breast reduction. I'm starting this topic with this slide. So when coming to pedicle design, as I mentioned, there are only 3 points that we need to concentrate on about the...
The advantages are there is a reduction in the serum rate because of lack of abdominal wall fascia exposure, and the lymphatic tissues of femoral region is left intact. Since there is a minimal elevation of the supraumbilical abdominal flap, abundance of abdominal wall muscle perfectus is left intact. In case of a thick abdominal flap, liposuction and thinning can be performed safely. Elevated, once umbilical stalk is elevated, an infraumbilical incision is marked, and the flap is elevated by leaving a thin layer of tissues at the posterior wall so that lymphatic drainage and seroma is minimized. Once we reach that umbilicus, a tunnel is created only to the level where we can do the facial attachments, and it has been assessed till we...
One of the common procedure done in, especially in women, even though both male and female have fatty deposits in the arm.
Cancer is now quite good with the modern treatment. And if you are going to think in terms of the disease localized to the breast or to the axilla.
So good evening. I welcome all the delegates for the post-tea break session on aesthetic papers. I would like to request Dr. Murugesan R to give his presentation on endoscopic rhinoplasty.
The following surgeries: endoscopic forehead lift, face lift, endoscopic breast surgeries, endoscopic abdominoplasty. These 3 papers I have already presented, but so that also can be removed under vision. All can be seen in the monitor. So it is just like a running video or do
Every 20 to 30 years there is a great change. Initially they were injecting paraffin wax, then fat transfer came, and then silicone injections, everything.
The most common area affected because of aging. We all know the aging patterns in the face. Out of this, the most important thing is the aging that happens around the eyelids.
Do this for each and every case, and so in this patient you can see the number of grafts which was required to do in the first session to cover the frontal and mid scalp. We calculated it to be somewhere around 1130 to 1630 grafts. We took around 1000.
Again, thank the organizers for giving me this opportunity. So, non-surgical cosmetic procedures, the least ventured entity among plastic surgeons. Definitely it is apart from scar revision which we can use. We have got lasers like CO2 laser and micro needling, radio frequency and chemical peels. But these things we really as plastic.
Very sorry for the confusion. The first speaker will be Dr. P. Rajendran. Will be speaking about paradigm or shift in DFS from palliative to prevention, role of plastic surgeons.
The left-sided surgery so as to prevent the foods from going into the right-sided ones. Why is it so? Because the surgery it has to address the key issue as famous had a problem since the grafts were not that it did not give enough cushion, so they had recurrent ulceration while doing and had to change their jobs. So free flaps, there's better compliance to footwear as you have seen in the previous.
I'm currently practicing in Tengasi, which is a third-eye city and is well known for its Kuttalam Falls and Kasi Viswanathar Koil. So when I completed my degree 2 years back, and I went.
Where, sir? Okay. Introduction. Lower one-third leg is traditionally a zone of requiring microvascular free tissue transfer to restore soft tissue coverage. So lower one-third leg defects as
facial defect to prevent the recurrence. Associated faulty biomechanics which is responsible for precipitating and perpetuating the heel ulcer has to be dealt with rejuvenation.
Wall are comparatively thin. So the next option we could think of is a free diap flap. Usually these flaps are based
vessel based proximal fibular reconstruction of the radiocarpal joint following a giant cell tumor excision. Materials and methods of
multiple sites in teenagers and young adults. So it's a chronic inflammation of the pilosebaceous unit. Most commonly affected areas are where there is.
And start the session. Thank you, sir.
Free fibular flap has stood the time, and it has become a very versatile workhorse for.
I have done 50 cases of free flap for the past 4 years for different etiologies like oncological, traumatic, post-burn surgeries. Sir.
mattress suture, is there any chance of necrosis of that little bit of tissue that is included in the mattress portion?
Theoretically, yes, but practically till now, I am fortunate enough to, I haven't found any such incidents.
That was for a very complex situation. Fellow got injured in Toronto, Indian fellow, and he had a big ALT flap from here to this place. So the artery we had to understand almost was in the mid-forearm.
Good evening to respected seniors. A moment of gratitude to my institute, teachers, seniors and colleagues. Why this topic? This is not basically a scientific topic, but it's more of a practical topic. It is not to say that I'm the... Sir, it is like the surgical team will get 50,000, the anesthetic team will get 15 to 20,000, the remaining goes to the nursing home. 50,000 for the two surgeons, 35 to 50,000 between two surgeons.
Good evening everyone, I am Dr. Gina George, final year resident at CMC Vellore. I am here to present a retrospective study on factors affecting free flap failure and flap salvageability in lower limb reconstruction. Free flaps are a versatile reconstructive option for soft tissue defects in lower limb.
Hello. Yeah, it's a nice presentation. The only thing I was wondering about was because Marco Godina also had said this, and you quoted that also. You said,
tell all of us, when you take the septic water rounds, every day, this is going to be your bread and butter. See, you will not get chances to operate thyroid or hernia in your career when you go into the surgical practice.
So this was a case of necrotizing fasciitis which I am presenting today, which was challenging not because of any complicated plastic surgery technique, like a bone marrow transplant.
So not connected with this?
No. He was completely down because of that. His counts were completely down because of that.
Okay.
So that was what my problem was with this case.
Good evening, everyone. So this was a patient who presented in our hospital, picked up in a community outreach program, and he was posted the next day for a above knee amputation.
See, if you are not getting a primary closure, see, it is not so easy as you showed. I have had my own experience. That has come out very well, even in very large, huge cases. Because it is better not to allow the patient out of your hospital.
Only when they are not able to manage. So when they are not able to manage is when the lesion is large. Okay, so stage 1.
For established cases, we have to excise or put a graft, primary closure there. But early cases, my feeling I have been doing for many years, in the gland that goes in for acute abscess, fibrosis and all things. Yes. That's what I have been doing for many years. But for early cases, I apply antifungal ointment for a month.
Good afternoon, everybody. This talk is just to give an overview of wounds which we have managed with hyperbaric oxygen over the past 5 years.
The probably may be looking ischemic or may go die. By HBOT, it increases.
Because of negative pressure, under the atmospheric pressure, we go deeper. That causes more oxygen available into the plasma and to the cells where it needs.
The degradation kinetics of these materials are designed to match the stages of wound repair such as hemostasis, inflammation, proliferation and remodeling.
So even though we are reconstructive surgeons, sometimes amputation is a procedure which we may be doing.
The objective of the study is to study and evaluate non-healing sinuses of skin and soft tissue following surgical intervention to review the appropriate evaluation and management options available for atypical mycobacteria.
Introduction: it is a benign chronic inflammatory condition involving the natal cleft region, and the global incidence is 7 per 1 lakh population.